Now that we talked about all the measurements and topography and measuring your astigmatism, now is the time to consider choosing a lens for you. There are four broad categories of lenses that are mentioned here in the four boxes, and we will go through all of them one by one. You remember that in the first few slides regarding the measurements, I did recommend the more advanced technology for measuring your eye. However, here there is really no preference for me as a surgeon. This is completely up to the patient to decide which lens would suit his or her lifestyle better. All the lenses are excellent quality lenses, and they give you good vision depending on your eye situation. However, the exact lens that you will choose really depends on your lifestyle and how much dependent you want to be on glasses and other benefits that each lens provide. So I will go through them one by one. So first, let's talk about the Ohip lens, which is this option here. It corrects the cataract. Basically, once we remove the cataract, we can put the Ohip lens in. Some of the negative aspects of this lens is that it does not correct astigmatism. Now, if you do not have astigmatism, it does not affect you. However, if you do have astigmatism, you would still end up with a significant glare after the surgery. So you would need to use glasses to see clear in the distance. Also, the second point noted here, bifocals or progressive glasses are often required after surgery because you would not be able to see within your arm length. So for anything, for shaving, makeup, computer, phone, looking at your watch, everything up close would be blurry. So you would certainly need some glasses to help with that as well. The benefit of it is that obviously it's covered by Ohip, so it costs $0 to the patients. Now, the second class of the lenses is called night vision or aspheric. That's the technical term for these lenses. These are very similar to the Ohip lens. The only difference is that here it's noted it has improved contrast and night vision, which helps with night driving particularly. So if we have a patient who drives at night, is a truck driver, or would overall prefers slightly better contrast, I would recommend these lenses. Now the difference is not huge compared to the Ohip lens. However, based on the studies, you would end up with slightly improved reaction time when you drive, um, although this is very minimal, and slightly better contrast in the dark. So if you're driving at night, this is something you could consider. Some of the cons of this lens, it does not again correct astigmatism. So if you do have astigmatism, you would still end up with a glare. If you don't have astigmatism, that's a good choice for you. And again, because it does not it only corrects the distance vision, you still need either bifocals or reading glasses or progressive glasses to be able to see up close. And that includes reading, computer, your watch, shaving, makeup. And there's a minimal cost because of the enhanced features. And this fee you have to pay directly to the hospital. And again, the fee might change over time, but for now, this is how much the lens itself costs. The third class of the lenses that we will talk about is the astigmatic corrective lenses, or the technical term is toric. Basically, it corrects the cataract just like the other two lenses that we discussed. It has improved contrast and night vision, which helps with the night driving. So for folks who drive at night in the countryside, this is a great lens option, and it corrects astigmatism. So that's the big feature of this lens. So if you do have astigmatism, I would highly recommend this lens because it will correct it, and it will give you a better quality of vision after the cataract surgery for distance. Now, again, the cons of this lens, similar to the other two, you still need reading glasses or bifocals after surgery, and the reason is that it does not correct your near vision. It gives you only a very good distance vision. So for things like, again, shaving, makeup, computer, iPhones, you still need glasses. There's a cost to it, again, because of the advanced features. There's a fee for the lens that you have to pay to the hospital. And also there's a surgeon fee because of all the calculation and everything that is involved in the refractive planning for this surgery. Now the last category of the lenses is here. It's an extended range. It gives you the extended range of vision, these lenses. So it basically corrects your cataract. It has improved contrast and night vision capabilities. It also there are ones that corrects astigmatism as well. And the main feature of this that none of the other lenses has is that it's ideal for patients who want to minimize use of glasses because it gives you an extended range of vision, so it corrects your distance, intermediate, and near vision. So you would be able to drive, golf, and for intermediate, you can look at the computer, TV, and in the close-up, you can do your makeup, shave, look at your watch, your phone, and read with minimal or no need for glasses. And again, for some very fine prints, you might still, like if you're reading a prescription on your prescription bottle, very fine print, you might still need some cheaters. And the only downside that I would consider here is the halos at night. So if you are someone who drives a lot at night and you would be interested in a crisp vision at night, you should be aware of these halos at night. And in the subsequent slides, I will show you how exactly these halos look like. The cost is the highest of all the other lenses because of, again, all the features this lens would provide. It costs anywhere from $1,000 to $1,400 depending on which lens we pick. That goes directly to the hospital. This is the price, the cost of the lens itself. There's a $200 refractive fee that goes to our office. In this segment, I will try to explain a little more about the first three lens choices. So let's imagine that you do not have astigmatism. So we did not pick the astigmatism here. And we correct you with a regular lens here, which chose a regular lens. After the cataract surgery, you end up with the good vision in distance. However, as you can see, everything up close would be intermediate and up close. Both would be blurry, so you would need either reading glasses, cheaters, or bifocals to be able to see everything clearly, including the intermediate and near. So that's, again, the downside of these regular lenses. Now, let's say if you do have astigmatism, we pick the astigmatism here. So this is your vision if we correct it with the regular lens. So again, if you don't have astigmatism, you can end up with good vision in distance, blurry up close. However, if you do have astigmatism, you're going to be blurry in distance, intermediate, close, everything is going to be blurry. So for sure, you would need glasses to correct everything after surgery. Now, if he ended up correcting you with a special lens or a toric lens or a stigmatic corrective lens that corrects your astigmatism, this is how it would look like. So you would end up with a good distance vision, crisp distance vision. However, the near, the intermediate, and near again would be blurry. So you would need reading glasses or bifocals of some sort to be able to see up close. But again, for driving, walking around, you're going to have a nice, crisp vision. And again, Compare this with a scenario where you have astigmatism and you do not put a astigmatic corrective lenses. This is how you're going to end up. But if you do use the astigmatic corrective lenses or toric lenses, your distance will be much, much more crisp. Now, let's say you have a cataract. This is a simulation of the vision of what the cataract patient would see. Everything's blurry. The color hues are different. And now let's say the patient is interested in correcting a cataract and wants to put a regular lens in. So let's say we put a regular lens in here, and this is how the vision is going to end up. Good distance vision, so you can drive fine, but again, computer distance, which is the intermediate here, and the close-up, which would be your phone, shaving, makeup, your watch, all going to be blurry. And you need glasses. Some people are fine with this. However, if you are interested in getting rid of your glasses and you would want to see most of the day walk around with no glasses, then we could consider the extended range glasses. So just compare these. Let's look at the phone, focus on the phone now. And if you put the extended range one, you see how now everything is in focus. So you do see up close your phone, shaving, makeup, everything clear. Intermediate, computer, laptop, crisp, and distance, everything is in good view. So again, compare the regular lens with an extended range lens. Regular lens, extended range lens. Now, one of the things you have to remember with these extended range lens options, these premium lens options, is that if you look at the left panel here, so you can see that when you drive, your dashboard is in view, your phone and anything up close is in view, and distance you have a good vision as well. So good overall vision. Now the only thing is that at night you would get these halos around the car light. So if you look at all these car lights that you have a little bit of halo around it, you do see that at the beginning. Now if you come to the second picture here, now you can see that the halos are much improved after a few months. You basically neuro adapt and you don't see these halos as much anymore. It improves significantly after 6 months time. And I've asked many patients and it doesn't bother them and it's very minimal, but it's something you have to decide whether it's something that bothers you or you're okay with this. So basically you're trading off these halos with getting an extended range of vision. Now if you compare these two pictures to the right, now this one is the extended range. This lens here is a regular lens. As you can see, up close, blurry, your dashboard blurry. However, you have a crisp, nice distance vision. And these halos, if you compare between the two, it's minimal with the extended range, but it does exist. So you do see a bit of a halo. Now, these are more pronounced at night, as is shown in the picture, and during the day, almost there's not much of a difference between these two lenses in terms of these halos. So just to recap again, with the extended range, more expensive lenses, you get an extended range of vision, minimal dependence on glasses, but you do see these minimal halos, especially at night. With the regular lenses, the Ohip lenses, you don't get these halos at night. However, everything closer than your arm length would be all blurry. So this is the distinction between these two lenses. And these pictures very nicely depicts the difference of these lenses at night particularly. Now, just to recap, before you come to the clinic to assess your cataract and choose the lenses, you have to pick one of these four options. And I'm just trying to help you to make up your mind a little easier. Now, the first question you want to ask yourself, whether you want to get rid of glasses or not. If you do want to get rid of glasses, for good. So and this is your chance. This is your only chance you got for the remainder of your life to get rid of glasses. If you want to be able to drive and at the same time look at your laptop, a computer, and watch your phone without flipping your glasses on and off, then this is your chance. So I would recommend going with this lens. Obviously, the cost is prohibitive. Um, that's something you should see if that fits your lifestyle and your budget to consider this glasses. So now, if that's not an option cost-wise, or not wearing glasses is not something that you'd be interested in, then this we can rule out. So then we're left with three options. Now the next question is, do you have astigmatism or not? If you do not have astigmatism, this lens is not for you either. And then you would only consider the top two. Again, if you do have astigmatism, I highly recommend this because without it, your vision would still be blurry after cataract surgery. Now, let's say you're not interested in the extended range, you're okay with glasses, or you don't have astigmatism, then you're left with these two options. Okay. Now, these two, I really leave it up to you to make it your decision. The one on the right gives you a slightly better contrast at night. The one in the lens still a good option and it's free. So you can choose between these two, whichever you prefer. So I hope that I kind of summarized these lens options. It's not an easy decision, but it's really depends on your lifestyle. And we can talk about this more in the office. But please try to make up your mind and come in with some predetermined idea of what you'll be interested in. The other thing that you should also look into is that whether your insurance covers any of these lenses. Because if you do have a vision package on your insurance, it does cover your glasses every 2 years or so, and there is a segment that pays for a part of your or most of your lens. So definitely look into it because if that's an option, then maybe going for these advanced optic lenses would be a good option, and some of it is covered by your insurance. So look into that as well. As you know, even wearing glasses after cataract surgery costs money as well, a few $100 each glasses. So you can add them up throughout your life, see how much you'll be saving if you go with some of these lenses where you don't have to wear glasses. Again, I encourage you to discuss it with your insurance company and read your insurance contract to see if there's any portion of your cataract surgery or your lens options are covered. I really hope that the previous videos were helpful in helping you to make up your mind and decision so that when you come to the clinic, you're more prepared and you already know what decisions you're going to make in terms of your biometry measurements, your corneal astigmatism measurements, as well as your lens options. This is also an informed consent that I would like you to read carefully. And we will give you a copy in the office as well to read. You can also pause here and read it carefully as well. One thing I just wanted to summarize before we end the videos is that I want you to understand that you can have your cataract surgery completely free. That would include the ultrasound measurement, the surgery itself, and also the Ohip lens. Now, if the refractive outcome of the surgery is important to you, obviously you should consider the options that were discussed in the video, especially the optical biometry as well as the corneal topography or mapping, which assesses your astigmatism. And based on those, then you have a better understanding of your eye, and then you can make a more informed decision in terms of which lens would suit you better. And there's 4 broad category of lenses that we discussed at length. So hope this all helps. Again, read this carefully. We're going to have you sign this sheet at the office when you come see me.